I'm David Sturgess. I'm from Brisbane in Queensland. I'm Deputy Director of Anaesthetics at the Princess Alexandra Hospital. I think for my children, even from a young age, I shared with them that I went to hospital, that I go to hospital each day and that I help look after people and keep them safe and comfortable through a period where they're otherwise really vulnerable, and that I stay with them and keep them safe, even during a period where they're unaware and having important surgical procedures done. One of the things that I came across recently was a description of the anaesthetist in the context of an airline pilot. So we all hop on planes, we have a sense that there are risks but also benefits in terms of travel in an aircraft. But the pilot, we don't always get to see them and certainly don't spend a lot of time with them, even though they're with us for the whole journey, and their role is to keep us safe and comfortable. And I think that there's a lot of similarities that people who aren't as familiar with hospitals can grasp in that conversation. These are things that build with experience, and an awareness that we're dealing with people at a time where they've got a lot on their minds. So I usually introduce myself in a friendly way. So most people like to shake hands, and I introduce myself by name and role so that they know that I'm the anaesthetist, because in theatre scrubs everyone looks similar, and it's sometimes hard for people who aren't used to being in hospitals to get a sense of who's going to be involved in their care. Having introduced myself, I'll usually talk through things, clarify some expectations for the day, if there's anything that's particularly concerning the person or they're worried about, and talk through some of the expectations. And in doing that, I also have a conversation. People are often conscious of the risks of surgery and of anaesthesia, and I think that we've come a long way, particularly in Australia and New Zealand, in terms of making anaesthesia safe, and therefore being able to access more and more innovative treatment techniques. So I know it's safe, but the person in front of me might still have some concerns. So the conversation for me is, the next part of the conversation is about not so much talking through the risks as actually talking through what I'm doing to minimise the risks for people. I'll talk through what we're doing to keep people safe and warm and comfortable, and I find that sets the tone for the interaction. I think having a calm demeanour and being confident in your role, I think people can sense that as well. I think that in an operating theatre, the anaesthetist sets the tone of the room, and we've talked earlier about that early interaction and developing a rapport with a patient. And I think having a calmness is really important. I think people respond to that. So I think calmness, a confidence in the role that we're playing. I think that it's really important to pay attention to the details. Proper preparation is really important in terms of getting ready for an anaesthetic, but also in being ready for any unexpected things that might occur. I think that situational awareness is really important. Operating rooms and working as part of a larger team, there's often quite a few things going on, and information's coming to you via different means. There are monitors monitoring the patient, oxygen, blood pressure. There's different stages of the surgery. There are other personnel in the room who are helping out. So being, sitting calmly and taking in the information, being aware of the situation that we're in. And then I think that the final element is that responsiveness, the ability to act quickly upon the information that we're receiving, to bring that information all together, to make judgments on that, and to be able to respond in a way that ensures the patient's comfort and safety. I certainly love anaesthesia, but it makes me reflect on one of the conversations that I had early in my career with one of my mentors, who looked at me one morning and said, "If you find this exciting, you're doing it wrong." For me, anaesthesia, some of the things that we bring together are really careful preparation, getting things right, anticipating things before they happen, and a lot of the science and nuance in anaesthesia relates to that. So I guess I'm proud to report that day to day I don't often find anaesthesia very exciting, but I'm always fascinated by it. And I get out of bed in the morning, with a real sense of purpose, and go to work with energy. Over the past 25 years that I've been practicing clinical anaesthesia, it's been fascinating to watch the development of less invasive techniques. I now do quite a lot of anaesthesia for robotic surgery, for instance, and I think that the patient outcomes are spectacular, and the fact that we can offer patients these advances, anaesthetic advances that enable surgical advances, it's all working together towards best possible patient outcomes. So the robotic surgeons that I work with tend to do procedures in the pelvis, and the pelvis is surrounded by bone and is difficult to access by conventional techniques. So pelvic surgery, for instance, ovarian cancers, cancers of the uterus, prostate cancer, traditionally they've been quite major operations with reasonably, large incisions and take quite a long time to do. With advances in robotics, and the robot's not autonomous, so it's not quite like watching an ad for Tesla. But what the robotic equipment enables is that the surgeon is able to use their hands and more natural movements that then are conveyed from a console to the operating equipment that is the robot. So I guess technically it's robot assisted, but those advances are spectacular in terms of being able to undertake really intricate work and getting better outcomes for patients. So the incision tends to be smaller, the amount of discomfort that the patient has post-operatively is much less, and patients spend less time in hospital. So being able to give an anaesthetic that adjusts for the particular elements that are important for a robotic assisted procedure, I think it has been a really important advance, and now surgeons are able to do procedures and access areas that were traditionally hard to access and involve much larger surgeries.